Serologic pipettes are used for measuring and delivering volumes of liquid. Could be a reagent or a diluent. These pipettes are to-deliver pipettes, meaning they are intended to deliver the stated volume of liquid when using the correct technique. We generally use these pipettes when we want to deliver a volume of liquid between 1 ml and 25 mL. If we are delivering volumes of less than 1 ml, we should be using a micropipette. And if we are delivering volumes of greater than 25 mL, we should be using a graduated cylinder. In this video, we will demonstrate how to dispense the full amount of liquid from a serologic pipette. To begin, choose a pipette that corresponds to the amount of liquid you would like to deliver. Pipettes can be plastic or glass. In this video, we will be using plastic. For this example, we want to deliver 5 mL of red-colored water. So we will use the 5 ml pipette. Make sure the pipette is clean and not cracked or damaged in any way. Take your safety bulb and squeeze it to expel the air out of the safety bulb. Hold the pipette vertically with the pointed tip of the pipette immersed in water and place the bulb on the top of the pipette, keeping the bulb in a squeezed position. We expel the air before we place the pipette tip in the water because if we expel air when the tip is in liquid, it will cause bubbles. Gently release your grip on the safety bulb and allow the water to be aspirated up into the pipette until the water is approximately 1 to 2 inches above the calibration mark, or the 0 mark. Make sure you do not aspirate any water into the safety bulb. If this happens, you need to stop and get a replacement bulb. Now we will gently remove the pipette bulb from the top of the pipette and quickly but firmly place an index finger over the top of the pipette to stop the liquid from flowing out of the pipette. Take the tip of the pipette out of the liquid and use a Kleenex to wipe the excess liquid from the outside of the pipette so that the extra fluid does not flow into the test tube and invalidate our measurement. Keep the tip of your pipette hovering over the vessel that contained your water, but bring the meniscus to eye level. You may need to pick up the container so that the pipette tip is not too far away from the container, causing any splashing. Gently and slowly release the pressure from your index finger, allowing the water to flow back into the container until the bottom curve of the meniscus is at the 0 mark. Remember to keep the meniscus at eye level to ensure accurate measurement. Once the meniscus has reached the 0 line, use your index finger to apply strong pressure to stop the flow of liquid. Move your pipette so it is now hovering above the test tube. We are now going to remove our index finger and let the water flow freely out of the pipette into the test tube, making sure not to touch the pipette tip to the test tube at this time. Once all of the water has drained out of the pipette, there will be a small amount left in the pipette tip. Since this is a to-deliver pipette, we need to make sure we get the last drop of the liquid out of the pipette. We will do this by performing what is called a blowout step. To do this, when the water stops draining, you will place the safety bulb back at the top of the pipette. This time, do not squeeze any air out of the bulb before you place it back on the pipette. Once the bulb is secured on top of the pipette, give the bulb one firm squeeze. This will produce one strong puff of air and it will push any residual liquid out of the pipette. We only perform this step once. Remove the safety bulb from the top of the pipette. Touch the pipette tip to the wall of the test tube to remove any of the leftover fluid by capillary action, but do not drag the pipette tip along the wall of the test tube. If there is any fluid left in the pipette after performing the last step, it is meant to remain in the pipette. Dispose of the pipette in a regular non-biohazard trash can. Because we only used water in this example, we would not need to dispose of our pipette in a biohazard container. If the material had been biohazardous, we would need to dispose of the pipette in a rigid or semi-rigid leak-proof biohazard container.